One procedure that we've integrated into our practice and has been working really, really well is Invisalign, because it fits into a lot of different procedures. Sometimes if it's just to straighten teeth or just to close gaps, it works really well for that. We can also bleach teeth using the Invisalign trays. That's kind of a little bonus there. But a lot of times when we have to do a restorative case or an aesthetic case, we need the teeth lined up appropriately so that we can match proportions and just get everything right so that the form follows the function and the teeth are in the right place, so we move them around using the Invisalign. So it's not as cumbersome as having wires and hooks and brackets put on your teeth, and most adults don't want to be bothered with that, particularly a lot of people that we see in Washington that are out and about and in the public eye. It makes a lot of sense for them to have invisible braces that they can just pop in their pocket when they have to give a speech or do a talk or a presentation. It works rather rapidly compared to conventional braces too. The average Invisalign case takes about 11 months. It's a good tool for our armamentarium of things that we do that allows us to restore teeth and do a really nice job and not have patients running back and forth to orthodontists every 2 weeks. Because the Invisalign patients we don't need to see but maybe every 6 weeks or so.